Hello, friends, and happy Functional Friday. It's Angie with Heart Wellness Coaching. And on Fridays, I like to go live and bring you some information to help with your health and to make you more aware of functional medicine. So, as a functional medicine certified wellness coach, I work with people to really address the most root cause underlying reasons why people have chronic health issues. So it's really fascinating to me how much lots of different conditions across the board that are very different from one another actually have a common root cause, a common factor. So you probably aren't aware of the fact that things like heart disease, diabetes, Alzheimer's, psoriasis, Hashimoto's, rheumatoid arthritis, all kinds of other conditions all have a common factor. And that list that I just gave you is actually just a drop in the bucket. There are so many conditions. There's hundreds of conditions that all sort of share this common factor. And I want to talk about that today. So if you're joining me live, please say hello in the comments so I can say hello. And if you're watching the replay, please let me know replay so I can give you a shout out later. So this common factor that contributes to all these different conditions, again, things from heart disease, diabetes, Alzheimer's, psoriasis, Hashimoto's, a variety of other kind of skin conditions, mental and emotional, anxiety, depression. These all share this common factor, and it's hardly ever talked about in a normal doctor's office visit, and it's hardly ever measured on labs, and we've really got to change that. So what I'm referring to is gut health and inflammation. So you're hardly ever, unless you ask, you're hardly ever going to have your doctor really talk to you about the health of your gut wall. They're very rarely checking these labs that are actually really accessible and easy to measure, that look at your systemic inflammation levels. So as a functional medicine coach, I'm trained to understand how our gut health is tied to all of these really common chronic conditions. So I can help people know what tests to ask for to see if they even have chronic inflammation, and many of us do. And there's a variety of tests that you can ask for that will tell you what's going on inside. A lot of people have no idea that they're inflamed until they have a heart attack, until they're diagnosed with diabetes, or until they all of a sudden have rheumatoid arthritis. They had no idea that they had this inflammation brewing that was building up and leading to this diagnosis. So I help people understand what are the common root level culprits for inflammation, and how do we address that at that level? How do we help heal up your gut so that we can reduce that inflammation, quiet down an overactive immune system, and help you feel better, help you feel amazing, actually. So you may be thinking, well, I don't have Crohn's, or I don't have IBS, or I don't have celiac, so my gut's fine. I don't have a gut issue. And most of us actually probably do have what's called increased gut membrane permeability, or it's also referred to as leaky gut, which means that your gut wall is not as intact as it should be, and things are getting through that gut wall that otherwise should be expelled from our body. So, and that's creating an overactive immune system that's seeing all of this stuff coming through the gut wall that it sees as foreign invaders, and so it wants to attack, and we end up with this just low level constant inflammation of this immune system that's overactive. So if you have any kind of skin issues, if you're having some gut issues such as poor digestion, having a lot of reflux, having a lot of gas, constipation, diarrhea, a lot of bloating. If you eat foods and all of a sudden you look like you have a 5-month pregnant belly, that's not a healthy gut. And many of us can have a relatively healthy gut, but eat certain foods that our bodies just don't like. And we all have our own ecosystem. So that's important to remember. It's not a one-size-fits-all approach, because we're all living in our own ecosystem. So one person might be just fine eating a certain food, and another person they bloat up and look like a Buddha. So we need to remember that there is a lot of individuality in what we can eat, and knowing and listening to our body is really important. If we don't listen to our body and we continue to eat things that make us bloat, make us have reflux, make us have GI issues, then we're just adding to an inflammatory setting that's already going on in the body. So skin issues, bloating, constipation, other GI issues, brain fog, anxiety, depression, chronic fatigue, chronic pain, high blood pressure. So many of these things are actually the result of inflammation. And when we can lower that inflammation, we see a lot of these things just going away. I've seen people taking pain medication every day, and once they go through the program that I teach and remove those factors in the food that they're eating, they're off their pain medication. They're not having to go to the chiropractor every week. I've seen people go from having debilitating brain fog, like hardly being able to really function, to having total clarity of mind. It's really amazing how much what we eat affects so much in our body. Food is not just macros, and it's not just calories. Food is information. Food tells our cells what to do. Food is so important. It is so important. I mean, if you think about food being information, what do you think an Oreo is telling your body to do versus what do you think a piece of broccoli is telling your body to do? So think about it from that perspective. Food is like the software for the hardware of your body, and it is full of information to tell your body what to do. So it's important to learn, what foods tend to be really nourishing, what foods tend to be a little triggering and can contribute to inflammation. And I go over all of those things in my program and help people understand what things really make their body run well on, and what things maybe on an individual basis don't do so well. So anyway, I wanted to share that. So functional medicine is a very deep dive root cause approach to looking at your health and what things have kept you from being at your optimal health. We use food as medicine, and medicine is food. We sometimes will bring in supplements when that's necessary to get people just up to a healthy baseline. I don't think of supplements necessarily as forever things, but a lot of times they can be really helpful. So mostly food, lifestyle, reducing stress, improving sleep, improving mindset. These are all parts of what we do in a functional medicine model. So just wanted to get on and share that. And I hope you're all having a great Friday, and I hope you have a wonderful weekend. Love to you all. Bye-bye.